If you get pain in your lower back or sciatica when you walk for a long time, you may be suffering from lumbopelvic instability. Dr. Nicholas Mercer with uImproved PT. So, what exactly is lumbopelvic instability? It's kind of exactly what it says. We have some instability in the lumbopelvic region. A lot of times that's related to the SI joint. The way the SI joint works, it's not like a lot of typical joints. The SI joint is kind of flat like this. It kind of contours depending on the person, but it more or less lays flat like this, and it has little movements of translation, right? If we sit for a long time, if we stay in a position that allows tissue creep, which is essentially a position that puts strain and pull on ligamentous tissues, we can get instability in those joints because it slowly over time lengthens those ligaments and they can't hold the SI joint or some other joint in your lower back pelvic region in place properly. Now, does that mean that if we have that tissue creep, they're lengthened, we can't do anything about it, we're always going to have lumbopelvic instability? Not necessarily. A lot of times we can use proper stability and mobility in other places in order to provide stabilization and decreased strain and basically pain through that area. And the most common musculature we need to use for that is essentially anything attaching to the lumbopelvic region. So we want to make sure that we have proper strength in the hamstrings, the glute muscles, the abdominal muscles, obliques, lower back, the lumbar paraspinals, but also we want to make sure that we don't have increased tension or muscle spasms or anything restricting the lengthening of the muscles around these areas either. Lumbopelvic instability, it doesn't necessarily sound like you would want to make muscles more flexible, but this is how that works. If we have compensations, let's say in the hip joint, right, between the femur and the acetabulum of the pelvis, we may compensate in either the SI joint or the lower back in order to perform a certain movement, such as walking. If we don't have the proper mobility inside the hip joint to move our hips to flex, extend, have that little bit of rotation and abduction-adduction stabilization, then we are going to compensate in another area. We are going to get that movement from another area. That may be your lower back, that may even be your SI joints. So essentially our goal in treating lumbopelvic instability is obviously we want to get you out of pain and we want you functioning a lot better. But how do we accomplish this? Well, first you want to identify your deficits, which can be kind of difficult to do if you're not working with a trained healthcare professional or if you don't have guidance on how to test for certain deficits, such as a decreased strength of the abdominals or of the lower back, the lumbar paraspinals, or even the glute max muscles, hamstrings. The list goes on and on. Your deficit could be in a lot of different places. However, one of the most common deficits we see is a decrease in the strength of the lower abdominals. Now, when we can't stabilize the lumbopelvic complex because of weak abdominals, we are going to get a lot of compensations in the SI joint and the hips. Now, if you have this tissue creep where maybe the ligaments stabilizing or helping to stabilize the lumbopelvic complex in the SI joints have been lengthened, which is more or less irreversible, we are really going to need that abdominal strength to stabilize the whole complex here. It just goes to show you that with the proper strength and mobility in the proper places, we can still have these tissue abnormalities without it affecting our lives, especially if you need to walk for prolonged periods of time, which essentially everyone needs to do. So one way we can kind of start to get this abdominal activation to stabilize the lumbopelvic complex in a functional position is if we just stand up, right? We want to stand up nice and tall. And again, this is just the first step. We need to integrate this into movements later on, but we need to learn how to activate those lower abdominals first, okay? So first step would be standing nice and tall, getting that back nice and straight, feet flat on the ground, about shoulder width apart. And from here, you're just going to pull that belly button in and try to get a little bit taller, okay? I've showed you this in a lot of other videos. Lower abdominal strength is a factor in a lot of different conditions, especially associated with back pain, but it's even more common in patients with lumbopelvic instability. So I'm showing you this one again because it's very common and it's very, very useful. So again, just standing up nice and tall, we want to pull that belly button in, okay? And what you should feel is the muscles right through here pulling in, tightening to stabilize that complex, right? And you want to start to be able to take deep breaths, maintaining that contraction in the lower abdominals here. This is going to take a lot of practice, but that is an essential area, it's an essential core stabilizer that we're going to need to use if we want to have decreased pain when we walk in the lumbopelvic region, especially the SI joint. In order to start integrating that lower abdominal strength into the activity of walking, we want to start to train the lower abdominal strength in different positions. So what do I mean by that? The first position I would want you to train this in is one leg forward, one leg back, almost like you're walking. And then we're going to get, again, that nice tall spine, pulling in that belly button, right? Just doing that for 5 breaths, trying to keep that lower abdominal activation as you take nice deep breaths here, okay? And obviously you're going to do that on both sides because we don't walk like this normally. And remember, walking is a very dynamic activity. So we're going to need to train this in dynamic activity too. So we're going to need to train this in a dynamic way as well. And the way we would do that is basically, if you get that initial lower abdominal activation, we're going to put 1 foot forward and then step back, trying to keep this pulled in the whole time to stabilize that lumbopelvic region, the SI joint. And finally, the progression from that would just be to practice short walks, trying to keep that lower abdominal muscle activated. So we're set up nice and tall, getting ready for our short walk, pulling that belly button in, nice and slow, shifting the weight, keeping that belly button pulled in, and you can keep your fingers here to make sure that it's still tight as you walk. And over time, we want to be able to walk a little faster, keeping those lower abdominals contracted. So if you are experiencing some lower back, sciatica, SI joint pain when you are having to walk for a long time, learning how to activate those lower abdominals and keep them active throughout your walk is going to help stabilize that SI joint. It's going to help compensate in a healthy way for an SI joint that may be suffering from tissue creep. Those ligaments have gotten a little bit too lax. They're not as tight as they used to be, and we need to compensate with the lower abdominals. So practice that, and please comment if you tried it. Let us know how it went. Please like and subscribe to our YouTube channel for more helpful information like this on getting back to the activities you love without pain. And go to all our social media things because we're on all of those, and we've got kind of some different videos on each one, so don't miss out on any new information that can help you move more painless.